we're certainly here to talk about the advancements. And I'd like you to talk us through some of the true innovations that are on the horizon from your perspective.
Yeah, sure, absolutely. So, and to do that, I have to go back a little bit, right, to make sure that everyone understands the level setting. And again, there's a significant history in figuring out how to deliver oligonucleotides, and a lot of the work that made the messenger RNA therapeutics and vaccines as they are now possible goes back to a lot of work that was done in the siRNA space. And a lot of that work was focused on lipid nanoparticles, right? So I think most people are relatively familiar with lipid nanoparticles. If you inject a lipid nanoparticle that's encapsulating an oligonucleotide, it traffics predominantly to the liver, and it works very, very robustly. A lot of work has gone into doing this, which is great if you're, in the case of an siRNA, if your target is in the liver, or in the case of a messenger RNA, if the site of action that you want to have is within the liver. If you contrast that with the messenger RNA vaccines, where obviously I suspect a lot of the people who are on these calls have been injected with these because of the COVID-19 vaccines from Moderna and from Pfizer, those were intramuscularly administered. And they were basically able to get into the cells that they needed to get into because they were delivered into the muscle, and the cells are there. But the broader problem with messenger RNA therapeutics is literally in getting it into a cell that is not, a cell that has a benefit for the vaccine, or into frankly a hepatocyte. That's where most of the work has focused, because that is where it is readily possible to deliver to. Now, there's been a great amount of work done in delivery modalities that are not lipid nanoparticles, polymer-based delivery methods as well, though again, they predominantly do traffic to the liver. And then a lot of the other work has done what I'll refer to as, it's focused more on local delivery. So, and that, is a rather nebulous, definition, because local could be, as I say, into the muscle, it could be intrathecal into the spinal cord. So, and which is not really that local. There's it still has broad distribution from there. So it's really, the innovations are sort of a melding of what is known already, and that can be administered systemically, and what can be administered locally, in order to sort of limit the exposure of the messenger RNA to things that might destroy it before it gets to where you want it to be.